hii simu imetupa mabadiliko makubwa. Lakini sasa nilipopata hii simu imekuwa ni kazi rahisi.
Ninapenda, yani moyo wangu unafurahikia kwa sababu wakati wote nitakapokuwa na shida ninamwambia tayari daktari wangu wa nyanjani na anapeleka ripoti kwa daktari mkubwa huko.
A few years ago, I was doing pediatric AIDS research at a hospital in Malawi. And at this particular hospital, there was one doctor, and he was in charge of healthcare for 250,000 people. And patients and their families were walking and ox carting 100 miles to get to him. What I heard from the doctor is we don't know who needs emergency care, and we don't know who has tuberculosis unless they show up at my doorstep. And then I met somebody who knew the answers to those questions. His name's Dixon, and I'm really excited that you're meeting him tonight in the middle of this photo. Dixon is a community health volunteer. He has basic drugs, he has basic training, and when I met Dixon, he was walking 35 miles every week to hand deliver updates about his patients in his community. And I walked home with him one night, and I looked down at my cell phone, and I had 6 bars of coverage, better service than back in Palo Alto. And seriously, and it was clear that there was a new infrastructure that we could use to coordinate care and connect Dixon and his community to the clinic. I met a guy living out of a van on the edge of the Stanford campus, building some free text messaging software. I put 100 phones in a backpack and smiled at customs officers on the way back to the clinic. And we created a text messaging network around Alex, the home-based care nurse at the clinic. And in 6 months, the hospital doubled the number of people they were treating for TB. And they were providing emergency response services for the first time ever. And it worked. And it turned out that St. Gabriel's was not unique. There are 1 billion people who will go their entire lives without ever seeing a nurse or a doctor. So we created Medic Mobile, and since then we've been designing a toolkit specifically for clinics, community health workers, and families in the last mile of health systems. As one example of what we've built, we wanted to run complex apps on $10 phones. So we used something called a parallel SIM, which is a little microcontroller that slides under the existing SIM card, and our app shows up on any phone. And we can show you outside if you're curious. The only other use case at the time for this was jailbreaking iPhones back in the day. So we combined that with text messaging, and what you see in the middle, which is our core platform, it's a distributed web application, turn into essentially a command center for community health. And this can run entirely offline if we need it to. And it's our job to figure out the most important use cases for that toolkit. One example is helping health workers coordinate antenatal care and make sure every single pregnant woman delivers safely. We also help make sure that every child gets their vaccines in the first year of life. We ran a randomized controlled trial in India, and we saw an increase from 60% coverage to 97% coverage when our tools were in use. We've also shown that we can track infectious disease outbreaks 134 times faster than previous systems. And we're helping health workers keep track of essential medicines so that every single person can get access to drugs that they need. Since 2010, we've grown faster every single year, and right now we're supporting 9,000 health workers covering 5 million people in 21 countries. But our delivery model just got a big boost, and it's why we're part of the Fast Forward cohort. In all those 21 countries, we've worked on every single one of those projects. And now, for the first time at medicmobile.org, we're launching a one-click download for that entire toolkit so that any clinic anywhere can get up and running in minutes. And there are ways that you can help immediately. $100 will equip a health worker, $10,000 helps us reach 50 new clinics in East and West Africa, and $100,000 launches a new product. You can also write code, leverage your platform because you know it much better than we do, and help us with phone recycling. We've had 100,000 Americans send us their old cell phones that we then turned into funding for our projects. And this is where we're headed. By 2020, we want to be supporting 200,000 health workers, improving health for 100 million people, connected to any clinic anywhere. And we will not stop until we reach those goals. I hope you'll come and talk to us so we can introduce you to the mission. Thanks for your time.